we're obviously very, very pleased and gratified.
The public doesn't need to pay drug companies for this medicine. The public could grow it in the backyard with their roses.
A landmark decision on medical marijuana. Tonight, how the ruling in a Victoria courtroom could change Canada's laws.
CTV News at 6 with Hudson Mack.
Good evening. Thanks for being here. Medicinal marijuana users in Canada are celebrating tonight after a BC Supreme Court judge in Victoria ruled that they do not have to just settle for dried bud. They can bake it into their brownies or drink it in their tea. The decision strikes down part of Canada's medical marijuana law, which has only allowed patients to smoke pot in dried form. This ruling is important, and it comes after a constitutional challenge by a Victoria man who may have won this fight but still faces drug charges. CTV's Andrew Johnson reports.
Owen Smith and his supporters have reason to smile after a BC Supreme Court judge agreed part of Canada's medical marijuana law is unconstitutional.
This, to me, is a great step towards patients' abilities to control their own medicine. We took THC and cannabis away from pharmaceutical companies this morning and put it back into people's backyards where they can make their own medicines.
The ruling means medical marijuana users will no longer be restricted to smoking the dried form of the drug. They will be authorized to bake pot brownies, drink marijuana in tea, or apply it as a topical oil.
These modes of ingestion were potentially more effective and certainly potentially less harmful than consuming cannabis by way of smoking it or even by way of vaporizing it.
It's hard to think that somebody would want to deny somebody a safer form of medicating and essentially forcing sick people to smoke.
Now Health Canada will have to figure out how to implement the judge's changes. For the time being, patients who are licensed to grow and use medical marijuana will be permitted to eat it in cookies or drink it in tea. Justice Johnson will be back in court later this month to decide if that will continue for good or whether he will suspend his ruling to buy the government some time. Smith's lawyer thinks patients should be free to exercise their new right.
At the end of the day, I don't think patients should remain criminals for making cannabis tea when they have a license to grow it and possess it.
Owen Smith launched the constitutional challenge as he faces unlawful possession charges stemming from his time as head baker for Victoria's Cannabis Buyers Club of Canada, charges he still must face.
I'm really proud of all the work that we've done so far. Lots of the patients and members of the club have been very supportive, as well as other people from the community. So we're going to keep going.
Very confident that no jury in this country would convict Owen for making, the cookies and skin products. So that is another opportunity to change public opinion. Today we changed the law.
Andrew Johnson, CTV News, Victoria.
Here's CTV health specialist Dr. Rhonda Lowe. And Rhonda, apparently medicinal marijuana users aren't being restricted to just smoking the stuff.
That's right, Carrie. Medical marijuana users have a bit more choice now following a BC Supreme Court ruling. The court has struck down a section of the Health Canada law that regulates in what form patients use marijuana. The ruling states that restricting authorized users to only dried marijuana is unconstitutional. The decision stems from a challenge by a Victoria man who possessed the drug in other forms, such as cookies and a topical ointment for the Cannabis Buyers Club of Canada. Well, BC's chief medical officer agrees with the ruling, saying in a statement today, by consuming cannabis in these alternate ways, patients are able to avoid the negative health effects of smoking, which we know to be harmful to the lungs. Well, last month, Dr. Kendall was joined by former Vancouver mayors and BC attorneys general in calling for the decriminalization of marijuana. And for my patients, I believe the court ruling today seems sensible because it allows for individualization in the way they can use marijuana to best fit their medical circumstance.